Hello guys, welcome back to our YouTube channel. In the previous video we just discussed the topic of hypersensitivity, its fourth type, and started the topic known as infarction. Now we will discuss the causes of infarction. So let's start. Thrombosis or embolism. Thrombus is a solid mass usually formed in an uninterrupted cardiovascular system by accumulation of platelets that result in the decreased blood supply and cause infarction. The second cause is vasoconstriction. Due to vasospasm, there is decrease in the diameter of blood vessel that cause decrease in blood supply to tissue and cause infarction. The third cause is suppression of artery by tumor. If tumor grows in the vicinity of artery, that result in the decreased blood supply and result in the infarction. The fourth one is arterial portion, that usually seen in testicular torsion that results in the decreased blood supply and ultimately infarction occur. Suppression of an anterior compartment. In an anterior compartment syndrome, there is an accumulation of fluid. The excess fluid can suppress the muscle and specifically suppress the vessels that supply the four masses of legs. The sixth cause is venous drainage. Whenever there is venous drainage, that result in the congestion rather than infarction. When vein is obstructed, so some bypass channels are open. As a result, venous drainage is improved and prevent infarction. So when there is venous drainage in that tissue that has single efferent vein, so there is no bypass channel in the tissue. So in the tissue, venous obstruction that leads to infarction. Now we will discuss the types of infarction, which are red infarction, pale, or you can say yellow infarction, or septic infarction. Red infarction and pale yellow infarction. Red infarct usually seen in loose or sponge tissue in lungs, while pale infarct usually seen in solid organ and in nerve tissues such as kidney, heart, and spleen, which are usually dense tissues. Red infarct occur in these tissues that have dual blood supply. When one arterial supply is blocked, then tissue get blood supply from alternative route, but this route do not fulfill the demands of that tissue that result in the red infarct formation. While yellow infarct occur in those tissue that have terminal arterial circulation. Less chances of infarction in that tissue is basically occur in red infarct. Red infarct can be seen in those tissues that have congestion. Red infarct can be seen in blood vessels which are restored after occlusion. While in case of septic infarct, it is usually seen when vegetation from infected heart valve detached and migrate to the other side. Similarly, septic infarct can be seen when microbes infect the necrotic tissue that result in abscess formation. In case of morphology infarction, morphology infarct appeared as wedge-like or triangular shape. Initially it is not well defined due to hemorrhage, but in later stage it is well defined due to release of inflammatory mediators. Factors influencing infarction include location of tissue vulnerability. If a tissue has a dual blood supply, so there is less chances of infarction as compared to the tissue that has one blood supply. In case of tissue vulnerability, to ischemia also contribute in infarction. Aging neurons will die due to ischemia within 1 to 2 minutes. So this is all about today's video. Thanks for giving us your precious time. I hope this video will be informative for you. Please like, comment and share this video and subscribe our YouTube channel. Thank you.